Hello, this is Dr. Drew Hall with Upper Cervical Healthcare, Los Angeles and Carson. Our office specializes in this upper neck region and its influence on the central nervous system, mainly the brainstem, the spinal nerves, and the cranial nerves that come out of that area. But what I want to talk about today is suboccipital neuralgia. We've had about 10 cases literally in the last 3 months come into our office. For those who don't know what suboccipital neuralgia is, it's a severe pain condition, basically right here at the base of the skull, right where the head and the neck meet. They have excruciating pain. Some people it's constant, some people it comes and goes. Some people feel it on one side, some people feel it on both sides, some people feel the pain wrap up over the top of the head on one side or on both sides at the same time. And so medically, what they do is typically run a bunch of neurological tests that come up empty-handed, and just based on the clinical presentation of heavy-headedness, tight muscles at the base of the skull, and pain in that area, they diagnose it as suboccipital neuralgia. Now, what I want to talk about is a mechanism, a possible underlying cause for suboccipital neuralgia, because in our office, by correcting this upper cervical area, we see a lot of these cases either completely resolve or dramatically reduce in their pain presentation. So just a little bit about anatomy. On the right side of the skull, there are two nerves, actually right and left side of the skull. There's two nerves that come up. One is called the greater occipital nerve, and it basically wraps up over the top of the head. And then there's another one called the lesser occipital nerve, which is shorter. But basically, these people that are feeling this radiating pain up over the head, whether it's on one side or both, is because that nerve is involved. So on the back of the head, there's several layers of muscles. And then between the head, C1 and C2, there's a whole lot of muscles. The most common muscle group is called the suboccipital muscles. That's why it's referred to as suboccipital neuralgia, because of the pain in that area. But what can happen, what we believe to be the underlying cause of this, is whiplash type trauma, sports injuries, slip and fall accidents. I just had a case that fell in the kitchen and hit their chin on the granite countertop. I had another case 3 weeks ago that fell and hit their head on the toilet in the bathroom after getting out of the shower. Those types of traumas can cause injury to the structure between the head and the neck, and the top vertebra called the atlas can shift out of position, become locked. And the reason that's important in these suboccipital neuralgia cases, the reason they're experiencing this pain is the muscle tone at the base of the skull is in a state of chronic contraction or muscle spasm. And so with the people that are feeling the pain just in this general area, that's what's happening, is those muscles are tight from a prior injury, and the muscles are locked down because the joint motion between the head and the neck isn't the way it should be because of the injury. Now, the people who feel the pain wrapping up the back of the head, whether it be on one side or the other, those nerves are being entrapped. So there's such severe muscle spasm that's literally entrapping or putting pressure on the nerve and replicating the pain that they're feeling up the back of the head. So in our Los Angeles offices, we tend to serve people from Hermosa Beach, Carson, Redondo Beach, Manhattan Beach, Rancho Palos Verdes, Hawthorne, Carson, Long Beach. That's our Carson office. And then our Los Angeles office, we see people in the Hollywood and Burbank areas. But basically what we do is we take very precise imaging of the upper neck after we've run a battery of neurological tests that tell us that one of these vertebrae are locked out of position and producing pressure on the spinal cord. Once we have that information, we take a 3D cone beam computerized tomography scan. It's from the dental profession, but it's a very precise 3D imaging that we look at how the joints of the head and C1 fit, and that allows us to, number one, determine exactly how the vertebra is out of position, and number two, once we know how it's out of position, we also want to know how the joints are built. Everybody's built differently, and then once we have that information, a very precise correction is made either to the right side of the C1 or the left side of C1, and sometimes C2 is also involved. And the correction is designed to get the vertebrae locked out of position back under the body's control to get the pressure off the spinal cord. So then the muscles at the base of the skull, and actually through the whole spine, can unwind and rebalance themselves, and the posture can come back to how it should be. And most of the time, we find these people with suboccipital neuralgia and many other conditions resolve from getting this corrected. So our office offers a free consultation and exam. You can give us a ring at 213-399-7772. That's the LA office. Our Los Angeles office is 310-324-6172, and you can take us up on that consultation. Hope to see you soon.